Good evening, everyone, and thank you so much for joining. As you know, I'm Dr. Smita. I'm representing NXT Health Commune. That's our platform. Me and my co-founder, Dr. Kavya. We are on a mission to make sure that all the great startups in India are reaching out to their target audience and world knows about that. And that's the reason today we have DocTrue and we have Pushkar and Akshay, founders of DocTrue. And I'm really happy to take this discussion forward. But before that, could you please help me understand your background, who you are, what you're doing?
Hello, ma'am. Hello, Dr. Smita, ma'am. Thank you so much for inviting us on this podcast. It's a pleasure. We run this company called DocTrue, where we help hospitals reduce patient waiting time and appointment no-shows and increase their patient experience using their own WhatsApp. That means the
Hmm.
patient can now just send a hi on the hospital's WhatsApp number in their regional language, book an appointment in under 10 to 20 seconds, and receive real time updates about how many people are there before them. Is the doctor there or not? What is the ongoing
Hmm.
number? When will their turn come? Everything happening on the hospital's own WhatsApp. We are live in 30 plus centers across 8 states in India, and we have processed
Hmm.
over 2 lakh patient appointments till date. So that is
Okay.
in brief about the problem we're trying to solve and the impact that we've created so far.
Okay. Oh, perfect. That's like the exact elevator pitch that you have given. Before that, just tell me what's your background and what's Akshay's background?
Yeah, so our native is Bangalore itself. So
Oh, you're Bangalorean.
yeah,
Okay, great.
me and Pushkar are classmates from BMS College of Engineering, Bangalore. So we
Mm.
pursued
Mm.
medical electronics engineering. And I also have a background in content creation and also was kind of a content creator for almost 7 years on Instagram with
Okay.
more than 75,000 plus followers with
Oh, really?
yeah,
Okay, wonderful.
5 million reach per month. So, and post which I've also done a student exchange program with University of Arkansas on social entrepreneurship and things like that.
Mm-hmm.
So
Okay.
it's like Akshay's and my journey is almost similar because we started
Okay.
off together in first year engineering. We worked on a project called Helmet, where only if you wear the helmet, the bike will start. And then COVID happened. The second year and third year of our engineering, we spent in house. And then we were always curious about solving problems. And hence, we did internships in companies like Being the Parent.
Okay. So what came to your mind? What problem you have identified that you thought that, okay, let's build something around it?
Yeah. So back in 2021, so I got my braces treatment done. So it
Okay.
was a second wave of COVID. Pushkar
Hmm.
also had the same thing. I don't know, we're twinning on all sides most of the time.
I used to wear braces for 3 years,
Yeah.
so I understand the
Yeah.
pain.
So couple of months later, when we had braces tightening process, so it was just a 5 minute process,
Hmm.
but you had to wait for 40, 50 minutes until the orthodontist
Correct,
like
correct.
was coming
Yeah.
to the OPD for consulting.
Mm-hmm.
So the third month or fourth month later, it was in June, as we
Mm.
remember, is when I found that, okay, I spoke to a few people who traveled from Whitefield. If it's in Bangalore, they'll know, but from Whitefield to
Uh-huh.
Malleshwaram, which was like almost
Oh my
1 hour
goodness. Okay.
journey.
But why would you go from Whitefield to Malleshwaram for a dentist? Yeah, find a dentist in Whitefield
Yeah.
only.
So when I spoke to them, I realized that it's also the travel also adding up to
Hmm.
also waiting at 40 minutes inside the OPD. Then
Yeah,
I
yeah.
found that
The whole day
this
is
could
gone.
be a interesting problem to solve. And then me and
Hmm.
Pushkar discussed about it. And since he was also
Hmm.
going through the same thing, we related to it. And
Hmm.
I remember the call I made to him post that
Hmm.
he said he was traveling from Shimoga. So he said, if this is going to excite me, I'll just wake up. I'm very tired now. I need to sleep.
Okay.
So from ever since then, we've been tagging along to, solve this problem. So that's how it was a
Hmm.
personal experience which has led to, solve this problem of queuing in waiting time.
I understand. This was like a real problem. Like nobody should be waiting. And we see that doctors are also stuck in traffic nowadays. No, you've seen those news. So when you thought that, okay, this is a problem and technology is a good way to solve, but everybody goes for like building an app and other things. Why you guys thought that, okay, we should just build something on WhatsApp, create a solution that way? So how you build that solution together?
In fact, we started off with an app, just like any other
Okay.
Bangalore engineer would do.
Yeah.
So initially, what we did was first was identifying problems. So we
Hmm.
used to go talk to conventions, doctor conventions, the CMEs, ask them if
Hmm.
this is a problem you want solved. What are the other problems that we need to solve? We used to survey them. We
Hmm.
used to go in public places, survey random people with different personas to understand if this is something we want to solve. And then, as engineers, we've always had product obsession here in Bangalore. So we
Hmm.
had fixated on this one thing called, we wanted to track patients in real time. Like, so that
Hmm.
if we get the real time location, we could sort out the queue, was the logic that we
Hmm.
designed and we pondered upon
Hmm.
for a very long time.
Hmm.
My mom's sister runs an Ayurvedic clinic where the
Hmm.
volume is very high on Sundays. So
Hmm.
we
Hmm.
said we want to, manage that. And that's where we
Hmm.
launched it for the first time 2 years ago, where we
Hmm. Hmm.
started getting real patient feedback. And if we look back, that's the real, start of things. And
Hmm. Hmm.
we tried to build an app, but then we got stuck at Play Store. We did launch, but it was not so useful. So we went with a web app
Hmm.
instead. We were trying to
Hmm.
experiment. We were trying to get feedback, trying to build. We were always in the OPD, trying to understand what to do, what next, what other problems to
Hmm.
solve. And then we discovered WhatsApp because we wanted to send notifications in real time, and this web
Hmm.
app was not helping us out. So
Hmm.
randomly, Akshay, me, and our CTO at the time, Aditya, hopped on a call and said, "Why don't we use WhatsApp for alerting them? It's the notification."
Hmm.
Yeah.
And we used Gupshup's APIs 2 years ago, and we sort of hacked something which had that real transformation.
Yeah.
And then
Hmm.
that kept building, and we said, apps don't have volumes today. Nobody wants to download an app for getting to know their queue position. Rather do it on WhatsApp
Hmm.
where there is simpler
Hmm.
and the volumes are high. Another problem
Hmm.
we saw was in the doctors community. Doctors prefer having their own white label, and WhatsApp was
Hmm.
the easiest way of doing that.
Correct.
Hence, what we pivoted to WhatsApp, and yeah, that's about it.
Okay, beautiful. Pretty lean model then. This particular solution works for hospitals and clinics, or how exactly? Who's your customer?
We have wide range of customers currently with us,
Hmm.
from clinics to mid-sized hospitals to nursing home kind of polyclinics, we could call them.
Hmm.
uh, Initially when we started, clinics was the one to go because it was easy to get the decision maker to understand what we are trying to do and convince
Hmm.
them saying that this is going to help them. uh,
Hmm.
Over time, now we've evolved to say that also hospitals really face this challenges because they have higher volume, like they see
Hmm.
more OPD. So
Hmm.
and it's diversified into different specialities and different doctors, so where the
Hmm.
queuing actually needs more mechanism or process to be set. So
Hmm.
currently we do serve all kinds of customers from clinics to hospitals, but our
Hmm.
major target is the hospitals where there is more extra value add that they
Hmm.
can
Hmm. Hmm.
see, and we are confident about it as well in terms of.
Okay, okay. And how patients will get to know, like if the hospitals are using the technology, how hospitals will ask them to actually
Yeah.
use the app, or how exactly it works?
So initially, when we implement the process, so for example, just to add to Pushkar's point, is that
Hmm.
this was inspired by Number Metro's bot of
Okay.
booking a ticket on the Metro WhatsApp.
Hmm.
So it became a simple process to explain to a decision maker in the hospital.
Mhm.
So
Mhm.
when they discover as it's a white label, we can integrate this to their
Mhm.
website where the
Okay.
appointment bookings can be integrated. And then second was the
Mhm.
Google My Business. And then finally,
Mhm.
we used to place QR codes in the OPD as well, so that receptionists could actually say when a patient visited their OPD to say, hey, you can scan this QR code next time when you want an appointment.
To add to Akshay's point, our customers are who see anywhere between 50 to 100 OPD a day because that's where the pain
Correct.
point is.
Mhm.
And we cater to the top 20-30% of the market. The power law comes into play.
Mhm.
Like the top 30% of
Mhm.
the market sees 80% of the volumes. So that's where the
Mhm.
problem is. And even though
Mhm.
at a glance you might think that the market is small, that's a very
Mhm.
focused market that we want to go after because
Mhm.
there are more problems to solve there and there are more patient volumes. So,
Yeah.
but in fact,
Okay.
we've got customers across all segments, across all specialties.
Mhm.
So from
Correct.
pediatrics, women and child care, dermatology, veterinary, ENT, diabetes,
Okay.
everything. So we've got the opportunity to understand workflows in different specializations as well.
Mhm.
Since we work with all these different sets, our product
Mhm.
matured in a way where now we can cater to hospitals of any size, of any specialty,
Mhm.
multi-speciality, tertiary centers in any region on the globe as well. So with
Mhm.
their regional languages.
And if I say that in one sentence, if you tell me that how it helps a hospital or a doctor and how it helps a patient.
So how it helps a hospital is we reduce appointment no show. So appointment no
Mm.
show is the function of waiting time. In India, one
Mm.
out of four people don't show up after taking an
Okay.
appointment,
Mm.
which is a
For some other
staggering
reason.
25%. Now, for
Mm.
clinics, it's a direct OPD revenue which is being left on the
Mm.
table. For hospitals, 25 to 30% no show means the IPD conversions are also getting affected. That means
Mhm.
their top line is also getting affected.
Mhm.
So that's where we come in. We get in, we
Mhm.
transform the pre and post consultation patient experience, reduce the
Mhm.
appointment no show by reducing patient wait
Mhm.
times, and have that positive incremental impact on the hospital's top line. And for the patient,
Mhm.
the problem with respect to OPD has always been access to real time credible information. Now, as a
Mhm.
patient, we get time slots as a time of reference. But the moment we
Mhm.
walk in through those doors, we start representing a number. We want to know how
Mhm.
many people are there before us. Is the doctor there or
Mhm.
not? What is my
Mhm.
number? When is my turn going to
Mhm.
come? That's
Mhm.
exactly the precise value proposition for a patient. In WhatsApp,
Mhm.
we've got something called check queue status, where every time the
Mhm.
patient clicks on that, he or she has a real time update at their fingertips
Mhm.
in one click.
That's perfect. But then, is it do you have the first movers advantage? Is it a very saturated market? Are there more competition for you, or you're solving some unique problem, and that's why you are safe in your own zone? What's your say on that?
So the way healthcare market in India buys is different from how the entire country buys. There is also this
Mm,
prerequisite of India is a diverse country with 29 different countries inside it, and the dialect
mm,
changes every 50 kilometers that we go, and the buying
correct.
patterns
Mm,
also changes. Respect to people who've already been able to convince and give value through their softwares. So in India, it
mm,
has become a museum of softwares. So there are like 24
mm.
softwares for multiple different functions. And
True, true.
because of the digital adoption, the digital fatigue that we are going through, they
Mm,
want it consolidated in one piece. So when we were
correct.
exploring the clinics landscape, we did find a lot of competitors, but
Mm,
we had to convince our decision makers to help them see the value, and only then it
mm,
arrived that If the pain point is real, then our product has value and we're getting the
Hmm.
price point. Our architecture and our codes and APIs are structured in a way where we can seamlessly integrate and we can go live as fast as possible. So yeah,
Okay.
doctors are the most intelligent set of people out there. Uh, Imagine
Hmm.
trying to convince this set of people. Number one. Number two,
Hmm.
genuinity is what is the value proposition. If you're not genuine,
Hmm.
doctors can smell it a mile away.
Hmm.
So all we have to do is be genuine, be humble, convey how we
Hmm.
can help them, and if there is a fit, there's nothing stopping us or him or them.
Correct. Correct. Nice, yeah. Your solution, you also said that you are available in regional languages,
Yeah.
Yes,
right? So, like if I'm Kannadiga, then I just put a message, I get the reply in Kannada.
yes.
Yes.
What all other languages are there?
All South Indian languages and Hindi. So Tamil, Telugu, and now also Malayalam is coming up.
Okay.
And Arabic.
Okay.
Arabic for the Middle
Okay.
East market as well. So
Oh, oh, great. And do you have any plans to go outside India and pitch there?
So Middle East is the immediate parallel for Indian markets, and there is
Mm-hmm.
some good business development activity happening there. So
Mm-hmm.
next few weeks, we're expecting some trials to start there. So some pilots to
Okay.
begin. So yeah.
That's perfect. Are you planning to raise more funds for the next stage?
So right now we're self-sustainable. That means
Hmm.
we're out of the struggle phase. We're surviving. We're able to make some amount of little extra money after costs from revenue.
Mm-hmm.
We have a clear plan of getting to 1,000 customers in the next
Hmm.
1 year, for which we will require funds. Uh, yeah, that's the funding story. To add on to what Akshay said, NSRCEL and IIM Bangalore have been, one of the biggest backbones for us because right out of college we were in Launchpad program. Right out of
Hmm.
Launchpad program, we got this Startup India Seed Fund scheme. And Jane Launchpad has also been our biggest backer because for the last 2 years, they've given us the freedom to experiment and explore. And today, there are very few startups in India who've been able to get an access into a hospital. So we've got an in,
Hmm.
and there are more problems to
Okay.
solve. There are more problems
Hmm.
to be discovered and solved. So
Hmm.
right now, it's only value. So only
Hmm.
value, only merit is what has got us till here, and of course,
Hmm. Hmm.
money that they give us. And
Correct.
thanks to the government, thanks to the incubators to take a bet on to college students. So, yeah.
Yeah. And if you can just spend a little time on explaining how IIM, program that help, how you enrolled over there, and how actually it is adding value to overall your venture. That's where we got connected. So that's why I want to know more about it.
yeah. So I think 2023 is when we applied for Launchpad program at NSRCEL IMB. So
Okay.
we were the youngest ones in that cohort to be selected,
Hmm.
uh, and it's been a very friendly while also more informative, insightful in terms of the value NSR cell has provided to us at
Hmm.
every stage. So it's our journey is as like complete drastic spectrum of ups and downs. So
Hmm. Hmm.
when at the lowest of lowest, they've given us the right mentors and given us the right
Hmm. Hmm.
guidance to see the future of how, let's say, not future in terms of 2 years or 3 years, at least see
Yeah.
how next 3 months or 6 months can, better
Hmm.
our process in terms of how we can improve our business marginally and then slowly pick up from this pitfall that we are at. They have exciting set of mentors, and that's
Hmm.
how we also met you as well.
Yeah.
So we're
I've
all
yet to contribute much, but yes, I
yes, yes,
agree.
of course. I mean, there is always more to learn, and whenever we walk into
Yeah.
the NSR cell office, we pick something new from everybody to learn, and it's exciting the way they
Mm-hmm.
approach. It's been really like they believed in us, so they believed in us
Mm-hmm.
through the journey, and then we are now part of the revenue velocity program of revenue state
Mm-hmm.
startup. So
To add on
Okay.
to Akshay's point, there were a couple of more early backers for us. Without that belief early on, maybe we couldn't have made
yeah,
it so far. Now we are at least at a point from the last 4 or 5 months where we're able to, pay our own salaries, take care of our expenses and costs. And as of July,
Mm-hmm.
we made a little considerable profit. The final green after 20 reds. So, yeah.
Okay. Another thing, if you look at like ours is a very massive country, the number of hospitals, clinics that are there, and we are a big country. If you're looking at like I want to acquire India, imagine how big market we are already talking
So
there. And
there is one slight
yeah.
problem. Uh,
Hmm.
Price point compared to cost of customer acquisition. If it is
Hmm.
not matching, if the margin is not there, then there is no point in looking at scale economics. The
Correct.
problem is
Hmm.
price point primarily because, for
Hmm.
example, let's take OPD solution and let's only
Hmm.
consider the unit economics of OPD. Let's say an average doctor
Hmm.
in India, the average consultation fee is 600 rupees in a hospital,
Hmm.
and
Hmm.
around 66% of that goes to the doctor, and the hospital is left with 33% of that. Now,
Hmm.
33% is the operating contribution margin for a hospital. When we go to them with the
Hmm.
solution and tell them that, hey, this is going to change your life, but you've got to set
Hmm.
aside 10% of your 33%, then they think, if I make this investment, is there enough ROI? So
Hmm.
unless the ROI is clear, there is no deal.
Hmm. Hmm.
Unless the pain point is not there, there is no conversation.
yeah.
So mapping
Correct.
out that becomes very important, and showing,
Hmm.
knowing your numbers with respect to price point, cost of acquisition, and unit
Hmm.
economics is the core, most fundamental thing, especially healthcare,
Hmm.
because getting the price point is hard.
Just to add
Correct. Hmm.
to the question you asked specifically is uh, like we also went through this journey of being in third year of college and trying to build something on our own. Like we do also find the problem of access towards bringing a young founder to action, which is
Hmm.
we out of our own grit came out and trialed with clinics and all of that. There's
Mhm,
few
mhm,
also people out there when we go speak to students or juniors who have this process of bringing something into live into life, but still
mhm,
the action or the access. For example, this particular information itself is a knowledge base. This entire
mhm,
conversation could be a knowledge base for somebody sitting somewhere in tier 2 tier 3 India to when
correct.
they have that mindset now of building something on their own. So a lot of people in India are innovative, is what we know, like very creative. The only thing is
Yes.
they need the right set of people for them to bring it into action, because someone not
Mm,
sitting in, let's say, entire three city in India doesn't know whom to talk to, doesn't know should
mm,
we talk to Pushkar or Akshay or whom
correct.
to connect and get that access and unlock
Mm,
potential of going forward. I think that is a problem that needs to be addressed very
mm,
specifically,
mm.
is what we feel.
Okay. Like especially in chronic diseases, take example of all the immunological conditions, compliance of the patient is very important.
Correct.
It's just not about the follow up, that okay, you're sending a reminder, you should, because the medication and the course of treatment changes based on how patients are responding. They have to visit the doctor, and by some other, like now it's the festival time, right? And we all Indian, we just try to skip everything when the festival is there. Like in right now we just finished all the 10 days Ganpati and everything, right? And that's where I think especially in chronic diseases, immunological conditions. It becomes such a big problem if the patient is not visiting regularly, and the medications, prescription, everything is dependent on how the patient is responding. And that's a good problem again you're solving, right?
The problem you just told is part of the roadmap which is already being developed. So,
Hmm.
so
Okay. And it can be customized as well. So if I'm from immunological, oncology, or diabetes,
yeah,
based on
yeah.
my specialty, I can customize my communication.
Another
Okay.
challenge that we saw, now we spoke about how do we get in, but how do we,
Hmm.
keep it running? Another problem we
Hmm.
faced was adoption. Now,
Hmm.
doctors are kind of tech savvy who can understand
Hmm.
faster, but there's
Hmm.
also the front desk, and because we're more of an operational flow, it requires us to
Hmm.
stay there, handhold their staff for some time until the flow is streamlined, and we're happy to do that
Hmm.
because that's where the impact
Hmm.
is. So yeah,
Hmm.
just wanted to add on to
Okay. Assume tomorrow morning you have around 100 million in your account. What will change? What would you do?
that. Interesting. We would deploy capital on reaching out to every nook and corner of India and the world, uh,
Hmm.
explore more problems. Because right now we've just got our foot inside the hospital, and there
Correct.
are a lot more problems to solve which we don't know yet.
Hmm.
Some of them we know, which is already in the process. Now, India
Hmm.
is such a diverse country with diverse problems. And one of the reasons why we took up biomedical engineering is we believe that in healthcare there are more problems to be solved with technology than any other sector.
Hmm.
And we will
Absolutely.
deploy capital on more problem discovery and
Hmm.
understanding value propositions, because the more deeper you go with problem understanding, the better the solution gets. The
and
better the solution, the better the price
and
points.
also completely deploy as much as capital on getting the right distribution network to for our
Hmm.
software to be channelized through that
Hmm. Hmm.
would be our only thing with that money.
Correct, correct. I just have couple of few more questions. Is any kind of funny or weird feedback that you have received? I talked about everything nice so far, but any different experience when you reached out to your customers or during this whole journey?
We've got we've got all kinds of experiences. We've got
Mm-hmm.
sometimes we've got kicked out of rooms. Sometimes we've got treated as the best people in the world. We've got
Mm-hmm.
people say this won't work. Do something else. We've got people tell us
Mm-hmm.
that you can't be Mark Zuckerberg. You should do something else. Uh, and
Mm-hmm.
there is a wide range of these feedbacks and tips that we keep getting, but that's okay. But one
Mm-hmm.
superpower we've got is whenever somebody tells us you can't do it, we take it up as a challenge and we end up doing it anyway. So yeah.
Mm-hmm. Beautiful. Acha, so tell me one thing, and this I ask almost everyone that those who are into entrepreneurship and those who are founders, that what keeps you going, what motivates you when you get up in, and both of you needs to answer. My answers might be different, but what's that inspire you to get up in the morning and do this all over again? And it's a tough journey. We both know that, right? We all know that. So what's your motivation, Pushkar?
It's the vision, man. Um,
Hmm.
we we're out on a vision. We have a vision to change the way people perceive, visit, and interact, engage with healthcare centers in India. If you see, we
Hmm.
are in a capsule in tier one cities. Only when we went to
Hmm.
tier two and tier three cities, when we went to set up hospitals, we understood the real impact of our product. Uh,
Hmm.
Maybe non-medical, there is some real impact that's happening, and
Hmm.
we believe that India is no less than any other country in the world, and we have to be
Hmm.
number one. And it's our mission to help equip Indian healthcare centers to give the best quality of care pre-consult, consult, and post-consult to the patient, after the consultation, their care journeys as well. So
Mhm.
it boils down to the vision, and
Mhm.
when you taste the impact of what you build,
Mhm.
uh, the money aspect goes away. So when you look at people's eyes, and when you know that this is a reaction of the last 4 years of hard work, that's enough
Mhm.
satisfaction for anybody. And to get here, all you have to do is survive, become
Mhm.
a cockroach, save money, spend less, just keep surviving. You know, cockroaches survive nuclear, incidents, something like that. So, yeah.
Okay, wonderful. And Akshay, what makes you get up every day in the morning and then start this again?
Uh, it's the story of us both itself that
Mhm.
excites me and drives me with grit, that we've come
Mhm.
so far from being college students to that. And of course vision is there. So if you see myself or my family members, my mom, my dad, or anybody, uh, would next 3 years be same way how my parents or anybody else's, or like the entire world would be going and visiting
Mhm.
hospitals in such a fragmented manner, right?
Mhm.
So that needs every time, it's every day that's the same conversation, like what else new can we
Mhm.
do, what else is there new to learn, because we've
Mhm.
now set ourselves good stage to learn from one of the best people in the world, that is doctors, of course, right? So what's the next thing, what's next big thing
Mhm.
to address? We have accomplished,
Mhm.
uh, we are at the stage zero, maybe we don't consider even at one we've achieved something. So
Mhm.
there is more that we need to capture out there. There is more to learn.
Mhm.
So that for me, it's about learning. It's about seeing, capturing the right opportunities to cater to that vision and achieve that at end of whatever. So so this drives me every day to.
That's wonderful, yeah. Before I close, what's the message you want to give? Like, if I say that anybody listening to this podcast, what's your message to them?
We will help you reduce waiting time, and we will help you reduce appointment no shows by 50%. We'll help you add Google reviews. All of this done using your own
Mhm.
WhatsApp. We will help you improve your operational efficiency with your front desk, with your current workflows. All
Yeah.
of this done using a very user friendly, minimal click software, which can be integratable with your backend systems. And to all the founders listening out there, just keep surviving, just keep discovering more.
For all the early ones out there, all you have to do is start, take some action, take some leap,
True.
and
True.
you'll get there eventually.
If any hospital doctors, those who are listening to our podcast, if they need to take the demo, what's the process of reaching out to
So
you?
they can,
What's the best way to
yeah,
reach
so
out to
they
you?
can reach out to us on our website. That's www.doctru.in, and they
Mhm.
can request for a demo there as well, or
Mhm.
they can reach out to us on LinkedIn or any socials as well.
A small,
Yeah.
message. You the name DocTrue uh, is the way we call doctors in Canada. In Canada, we call
Mhm.
doctors DocTrue. That's the name.
Okay. Uh-huh.
That's more of an Easter egg
Yeah.
for the Kannada audience listening.
Okay, okay. What do you say? How do you say that in Kannada? In like, thank you for inviting us on this podcast, and we want Doctor to reach to as many as hospital doctors possible. So, if you want to say that in Kannada, how would you say it?
ಧನ್ಯವಾದಗಳು ಎಲ್ರಿಗೂ. ಆ, ನಾವು ಇನ್ನೂ ಹಲವಾರು ಹಾಸ್ಪಿಟಲ್ಸ್ಗಳಿಗೆ ರೀಚ್ ಔಟ್ ಆಗೋದಕ್ಕೆ ಆ, ನಮ್ಮ ಆ, ಸಹಕಾರ ಬೇಕು.
ಆಶೀರ್ವಾದ ಮತ್ತು ಸಹಕಾರ ಬೇಕಾಗಿದೆ. धन्यवाद.
आशीर्वाद आहे साकारा. ओके.
धन्यवाद.
ओके. I'll say that in Marathi. Definitely देव तुम्हाला खूप सगळं यश देव. And that's the beauty of our country, right? Like, okay. Perfect. And thank you so much, guys. And wish you luck. And let's connect again.
Thank you so much.
Bye bye.
Yeah.
Good night.
Thank you.
Yeah.